Welcome, guys, to the Couple Nurses podcast with your hosts, Matt Slarchik and Peter Findero. How you doing today, PD?
I'm doing good.
Alrighty, guys. So those that are new, thank you guys for coming, subscribing, listening. Please, guys, check out the podcast, listen to it, and if you like it, smash that 5 stars because it helps us rank on an algorithm. It promotes the show more, and we get shown more frequently, which means more downloads, and it motivates me and PD to give more high-quality content. So, PD, who do we have on today?
What's up, guys? Well, today we have a special guest on. Her name is Jeri Schulz. Jeri Schulz is a registered nurse with decades of experience in patient care and clinical administration. She has clinical expertise in managing cardiovascular services, intensive care units, 4 Chicago area inpatient hospice providers, critical care and telemetry units. She has earned Healthgrades Critical Care Excellence Awards 3 different times. Jeri is also a founder and CEO of Tulip Tree, LLC. Tulip Tree is a hemp-based e-commerce company serving the health and wellness needs of clinicians who care for others every day. And it's Tulip Tree, spelled TulipTreecbd.com, this website, if you guys want to check her out. How are you doing, Jeri? How are you today?
Doing fabulous. Thank you guys for having me on. I'm excited to talk to fellow nurses.
Yeah, we're really happy to have you on here. Where are you actually located right now?
Right now I'm in Cincinnati. You know, I was born and raised in Chicago and lived there all my life, but last 6 months I moved down here to be closer to family and to launch this new company.
And can you tell us a little bit about like what you're doing? So those that don't know Jeri, she actually owns a CBD store and she sells products and she believes that maybe nurses and the public needs more awareness on the topic, correct?
Absolutely. Absolutely. I started out, as a nurse manager, really feeling the age and the aches and pains. And I know that there's a lot of my fellow nurses that have all of these issues that I have, and they're experienced nurses, and we're losing a lot of experienced nurses bedside. And so I felt CBD helped me, let me develop a product that can help other nurses stay at bedside longer because we really need their expertise. As I get older, I want experienced nurses taking care of me if I need ICU. So I launched Tulip Tree CBD. It's a hemp-based, zero THC product line that is designed to help with all the inflammation and the insomnia, anxiety that comes with being a bedside nurse. So we're doing well. I'm also doing education for nurses and for nurse practitioners. I was recently at Elmhurst Hospital and addressed their APN group, teaching them a little bit about cannabis and about CBD. Now that Illinois is adult use, a lot more patients are coming in that are feeling more relaxed about talking about their cannabis use. So practitioners need to know how to address that and how it fits into their medical regime.
So I'm kind of curious, what are like the biggest misconceptions you hear about CBD or anything like that? Because like when you bring like discussion about marijuana, people think that like those commercials that we used to see back in the day where somebody just sits on a couch and like sinks in and just turns flat into like almost like a zombie. What is like the most common question that you get or misconceptions about it? Because we know there's a lot of benefits for it, but people aren't really as educated on it as they should be.
It's true, and the situation you described, it's called couch lock.
Couch
And
lock.
couch lock, and it's a side effect of THC that will get people totally relaxed, and it's usually from smoking or ingesting indica, which is a more sedating level of THC. But one of the misconceptions is that one, if you do that, you're just a stoner and burnout and just want to get high. And while there is a population that does like the recreational use, there's a huge population that is finding the medical uses of CBD and of cannabis to be really beneficial for mitigating some of their symptoms, like the PTSD, like the anxiety, like insomnia. There's only over 50 million Americans that suffer from anxiety, and a good 70 million are varying levels of insomnia. That's a lot of people not getting the rest and the relaxation that they need to be able to function properly. So, THC is responsible for the euphoric effect. It's also responsible for helping people that have are doing chemotherapy and have wasting syndrome or that to help stimulate their appetites. It's also really good to help people with a lot of other social anxiety, depression, opioid use, all of those things. And CBD is there alongside of it. It's kind of the sister cannabinoid. And that has all the medical properties that you'll find for inflammation, insomnia, anxiety. And it also helps mitigate some of the high of THC. So if you're taking a product medically and you don't want to get really stoned or you're afraid of that, then if you take a product that has either a 1-to-1 CBD or take CBD as a supplement in addition to your THC, that will help you not get as high. It's also going to help you not get the munchies, like you're saying, those people that lay around on the couch and eat Cheetos or Doritos all day. CBD helps mitigate some of the munchies and some of that couch lock feeling.
I can
So
say I can say me and Matt had a few couch lock
Yeah.
experiences
Yeah.
back in the day, back in our younger days.
Okay.
so like me personally, when I became a nurse, I did try CBD before. Let's just say taking it before bed. So sometimes you have insomnia because you're a night shifter, especially with that,
Right.
and you get exhausted, right? And also helped. I purchased it for my father too to kind of help him to lay off the drinking a little bit to see if that could
Yeah.
help. Because usually underlying symptoms of alcoholism sometimes
Hmm.
is anxiety, and CBD is supposed to work to use that or to work for
Sure.
that. I'm not sure the quality of the CBD. I'm sure there's different kind of products that make difference. Sometimes it could be a shitty brand of CBD. But when it comes to like your company now, I'm curious, like what made you like say, like how was the hustle, the struggle of learning, building a website and everything that you did because you do all that. So I'm kind of curious, what's the back end? Did you like get not enough sleep? Did you have to kind of what kind of sacrifices did you have?
In putting this company together.
Correct. Just like
Oh yeah.
where you are currently in your your shoes.
I'm a veteran nurse, so I know nursing. Ask me anything nursing, I can help you out. Website design, all of that, business aspect of it. I really had to do a lot of self-education, and I reached out and found out what my weaknesses were, which is, a really awesome website. And I knew I wanted something that would stand out. So I hired some professionals to help me do what I needed to do. But yeah, a lot of sleepless nights. I take my products regularly, just to help that circadian rhythm and help me get enough rest I need to be able to function. It's a tough gig, and it's really I kind of relate it to ziplining. So this summer was the first summer I went out and I ziplined. It's kind of a bucket list thing. And I jumped off that first platform down in Asheville, in the treetops. And it's a leap of faith. And that's kind of how it felt like starting this company, just jumping off the platform and going 100 miles an hour and really having the passion that I have for my product and the help that I know it'll give people carried me through and keeps me going.
So, like
Okay.
regarding your products, do you just have geared toward nurses or just like general society? Like, what do you see like the most common reason people come in to and get these CBD products? Is it because do you treat a lot of insomnias or anxieties? Like, why do people seek CBD through you?
So yes, I sell to everybody, not just nurses. And people come to me. What I'm seeing mostly is people coming to me with anxiety and stress, and just being able to kind of wind down in the evenings as well. So I have a lot of people. It's inflammation, which is the basis for most of the disease processes, and it's a symptom of a lot of disease processes like arthritis or GI. And there's a lot of research out there that shows that inflammation is probably CBD's number one. CBD is beneficial for inflammation most, but being able to relax at night too, in the insomnia, PD, is crazy because, you have your racing thoughts and then you have your body that needs to relax. So CBD can be a real mind and body relaxant and help relieve some of that anxiety. And, Matt, it's really good for people who are self-medicating with alcohol to help them get off of that. Actually, if we have time, there's a quick story that got me really into the medical marijuana side. And that was that years ago, back in my college days, which is several decades ago, um, I was recreational like the rest
Was
of
it was it
the.
during the hippie time? I'm just curious.
It was. I am an old
Awesome.
hippie, unfortunately. And so, back in the college days, I was recreational and having fun with it. But my father, who was a very, very straight-laced conservative Republican politician, from the word go, what grew up in the Dean Martin, Sammy Davis Jr. martinis and smoking and all of that. So there's a lot of alcohol flying around that those particular circles. And he developed alcoholism, and the doctors told him he had to stop because he was killing his liver. So he turned actually to marijuana to help him wean off that alcohol, and instead of self-medicating with a martini, he would self-medicate with a joint, which was so much healthier for him and didn't destroy his liver anymore. But the first time I came home from college and he turned to me and said, "Jerry, can you roll me a joint?" I almost fell off my seat. I rolled him the best damn joint I ever rolled in my life. And I realized that, he wasn't drinking like he used to, but, he was able to function and carry on with that. So that was a huge foundation for me as far as the medicinal purposes for marijuana, and why I really truly believe in it wholeheartedly.
And ever since then, Jerry just had the golden hands, right?
I
And
just, I was always pretty good at that. Yeah.
that's awesome. So now my question is, we were talking about ICU nurses and burnout a little bit.
Yeah.
It's curious how you're taking care of patients that, let's just say, have ETOH, have anxiety, and it's almost your energies are being intertwined. And
Mhm.
sometimes you get a little bit irritated at the end of your shift. Like PD, you could admit it as well. Sometimes it's been 12 hours with the same two people and you love your patients, right? But if someone has depression and is continuously negative, or
Mhm.
anything you possibly do, any single way you elevate that pillow, their hips, their legs, no matter the amount of ice packs you give them, they're just unhappy and miserable. We have those patients in situations. Some of them aren't as, like, let's just say, grateful. Do you feel like, and I feel like I'll agree that nurses sometimes take that effect, so they do need like proper coping mechanisms. And I'm not saying CBD is the be all end all, but definitely it'd be a great supplement, because sometimes we take it out the wrong way, and you hear nurses say, "Oh, I'm gonna go have a bottle of wine when I get home." But is that the
Yeah.
best thing to do?
No. No, because really, if you think about it, alcohol, I don't know you guys, but alcohol does not help you get a decent night's sleep. It does not help you rest really good. I mean, you may pass out for a little bit, but in the long run, it's not the healthiest alternative for you. So, towards the end of the shift, when you've got these patients that have just worn your last nerve, taking a little CBD sublingually is a good way to help kind of reduce that anxiety and that stress level. And wouldn't it be awesome if we could give our patients some as well? When the federal government finally decides that this isn't, the demon drug that they've made it out to be, giving those patients that are just miserable and at their worst in our ICUs, a little bit of medical marijuana or a little bit of CBD would go a long way to helping them heal and to help our nurses not be so stressed.
Yeah, exactly. Like, you know,
Yeah.
like Matt said, a lot of patients have anxiety and all that. And our first drug to go to is usually Xanax. And if they can't
Yeah.
sleep, what do we give them? Ambien. And we all know Ambien long term is more harmful than beneficial. It decreases your REM sleep. And I completely agree. Once this
Yeah.
stigma kind of falls away, that marijuana and CBD are this, like, stoner drug, and the actual benefits come out to be more public, I feel like, CBD and, I don't know if they could smoke it in the room, but maybe like an edible of some sort would probably be a lot better than Ambien or Xanax. Even
Absolutely.
for nurses, like my coworkers, some of them take Ambien for sleep, and some of them take Xanax to relax when they're outside of work.
Mhm.
Like that's not really the best coping style, and it's something more natural like CBD or marijuana might be a lot more beneficial than some kind of pharmaceutical drug like that.
Oh, it's definitely much more beneficial than taking prescription medications, without a doubt. And you know what? Whole plant medicine, um, broad spectrum or full spectrum cannabis, either CBD or THC or combination, is much better than the isolates that you see out there. There's this thing called the entourage effect that goes into the medicine that has all these other complementing cannabinoids that help with the overall effect. So the sum is greater than the parts, and as far as cannabis goes. So you'll look at the products that I have, and I formulated a product that I would want to take, that I take every day. That's organically grown. It's filtered all the THC out of it, but it's broad spectrum, so it still has all those complementing cannabinoids. And it's really it's the ideal product. Now, you hear people say, I don't know, do you guys know what the endocannabinoid system is? Have you heard of that?
I've
No.
heard of it, but I'm not really familiar with it.
Yeah, it's an on-demand system that kind of balances our bodies and helps us to achieve homeostasis or balance. So when and the endocannabinoid system is throughout our whole body. So you have the CB1 and the CB2 receptors, and the CB1 receptors are mostly in the brain and a neurological system, and the CB2 receptors are peripherally and in our internal organs. And it's a chemical reaction and a response that happens when we're out of balance. And our bodies form natural endocannabinoids to deal with this imbalance, but sometimes it's not enough, especially with chronic anxiety or chronic diseases. Our bodies just can't keep up, which is why the phytocannabinoids in cannabis help to supplement the endocannabinoid system and really help our body achieve that homeostasis and balance. Which is why it's good for so many things. You hear cannabis and CBD, oh, it'll help anxiety, it'll help diabetes, it'll help inflammation and arthritis and all of these things. And you go, how can that possibly be? But it's because this endocannabinoid system in in all mammals, actually, they find, is throughout our whole body. And so the cannabis addresses all of those imbalances, which is so cool. There's a lot more research coming out. There's a lot of animal research right now, but there's a lot more human clinical trials coming out that help support all of these different aspects.
Jerry, if you have any important links you wanted to share, definitely send it over to us and we'll include it in the show notes for anybody that's listening wants to read more about the evidence based of CBD.
Absolutely.
And I'm actually curious on so how do you create the actual physical product? Is it like laboratory grown? It's not like a plant where it's just growing, because it's actually like tablets, correct?
No,
Or is
actually
it
it's
drops?
actual my product, my hemp is grown. It's a special strain that's CBD rich strain of hemp that's grown in Colorado. It's grown under organic growing practices, and then it's processed at my manufacturer in Colorado Springs, which actually processes it using minimal chemical processes to get out the CBD oil and then to put it into products like my tinctures, my gummies, and my soft gels. And then those products are shipped to me, and then I distribute to the country, whoever needs them.
Is there like different strains of CBD? Because I know with like marijuana
Yeah.
THC, you got like those the Granddaddy Perp, you got the Chem Dog, all these different cool names. Is there different things like that for CBD?
So Granddaddy Perp is a favorite of mine, by the way. But yeah, of course, there's all different kinds of strains of cannabis and CBD. And so some of them, the industrial hemp may not have as much CBD in it, so it takes larger volumes, but it's not, the CBD itself isn't like indica or sativa. It's not uplifting or couch lock, daytime or nighttime. the CBD molecule itself and all the terpenes are the thing that determine what you're working with. So CBD is CBD, but the complementing cannabinoids like the terpenes will help decide whether it's a super uplifting and or more sedating kind of profile.
And then regarding the, you said we have like the endocannabinoid receptors. Is that what they were called?
Yep.
Does that like deteriorate with age? Like testosterone decreases with age. Same with like estrogen. Does that decrease over time in our system?
You know, I have not read anything about that, and I don't know if they've studied it in a long enough duration to know if the endocannabinoid system starts to slow down as we age. It seems logical that it might,
Mhm.
but I haven't read any research that really addresses that.
Okay. And then regarding the terpenes, I'm not. Are you familiar with them at all? Because I know there's.
Yeah,
I was doing a little research back in the day. There's like dozens of different kind of terpenes. Correct? There's like different variations of them.
absolutely. So there's more uplifting terpenes like pinene and limonene, and then there's more myrcene is a more sedating one. And the terpenes are the things that give the cannabis its fragrance and its flavor. But it's just it really mirrors a lot on the basis of what aromatherapy is like.
Okay.
So when you have terpenes that resemble or mimic lavender, you know that those are more relaxing terpenes. If you've got terpenes that smell more citrusy, those are more uplifting and alerting. More. Um, so it goes by the smell and the scent. So you can really look at your cannabis, and if you smell it, and you get those fragrances from it, and that's why some of them are named what they're named, like lemon twist and all of these others. It's from the terpene dominance that's in the particular cannabis strain.
Wow, that's so interesting. I'm learning so much.
Mm.
Good.
Question like regarding like your like company. What are like your future goals and ambitions, and where do you see yourself in the next like 5 years? So almost sounds like an interview question. But I'm just really curious about
Yeah.
that you're building.
No, well, exactly. It's a good question because the trajectory of the company, I really want people to understand that I'm a national company and I'm looking for FDA approval for regulation so that we can start, having that conversation. But in the meantime, I have been going around doing a lot of education. So I'm also going to be splitting part of the company off and doing strictly education and counseling for healthcare providers and the general public about CBD, about the benefits of medical marijuana, and then really talking to physicians, patients that have recently obtained a medical marijuana card and helping guide them through the myriad of different products that they can choose from. If they're taking it medically, there's specific goals that they have that they're taking the marijuana for. Physicians don't necessarily teach them all of these things or know all the details or have the time. Education's always been a nursing job, right? So, I would go out and I would give dispensary tours, take patients around, show them what to look for in different products, the differences between taking an edible like a gummy or a soft gel, or taking a sublingual tincture or smoking it. They all have different aspects to them, and so it's a very personalized type of product that I think people need help with. So my company will get more into the educational side of things as we go forward, and help people really navigate the medical marijuana and the CBD industry.
It'd be interesting being a nurse and your patient asking, hey, let me get 10 milligrams of X name, and that's a CBD pill that you're handing your patient. You never know when it comes to futurism, let's just say in the next
Mhm.
5 years, that just might happen. And I almost see like money signs in my mind because I'm like, wow, there's going to be a market for this. Do you see your company going to that market where potentially you could be serving maybe patients in the hospital, or is that a little too far fetched at the moment?
No, I don't think it's far-fetched at all. And actually, I would love to see that day come. And it's not that far in the future that that's going to happen. But in the meantime, until the federal government decides that these things are okay, we can do things. I can do things not only in person as far as education, but telemedicine is a great way to reach more people and to really help guide them through all of this. Uh, but I think the education is needed because there is so much more to it than sitting on the couch smoking a joint and zoning out on Beavis and Butthead if they're still around. Do you guys know who they are?
Yeah, I do.
Oh, okay, good, Petey. Thank you for that. Yeah, I totally dated myself on that one.
No, you're fine. You're fine. I used to watch them like back in. I mean, I don't want to say back in the day, but like
Yeah.
a few years back, they were still kind of popular
You're still
on
a baby,
MTV,
Peter.
I think they were popular on MTV. Yeah. But I have a question. So you said that
Yeah.
when you try to help figure out what kind of CBD product would be best for like a future patient or like a client,
Mhm.
what would the difference be between like choosing like an edible or like a smoked version of CBD or even marijuana?
Well, so, smoked versions of marijuana are really good because they have immediate onset. But because they have immediate onset, the duration that it lasts is a shorter duration. So you may smoke a joint or smoke a bowl or vape, which I think is nicer than smoking. I like vaping a lot better because you don't get the combustibles. But you may smoke that and you can titrate your medicine because you get the effect right away. So you know if it's enough or not. And if it's not, you take another hit. And when you do an edibles sometimes take up to 2 hours. You should take your edibles on a full stomach because it's lipid based and it helps absorb faster into your system. And edibles can last up to 8 hours in your system. When you do sublingual tincture, that may take about 15 minutes, half hour to take effect. And those last about 4 to 6 hours. So, if you have respiratory problems, you may not want to be smoking. It's probably not a good idea to irritate your lungs a little bit. Although an important point is that cannabis users there is no evidence of lung cancer like you would get with tobacco. However, if you do smoke a lot of cannabis, it is a bronchial irritator. So, you may want to consider edibles because of that. Edibles are really hard to dose because it takes so long for them to take effect. And so sometimes people take an edible and then an hour or half hour later, they don't feel anything. So they take more and they end up stacking their doses. And by the time it kicks in, all of a sudden you are super high, and you didn't mean to get quite to that level.
I almost want to
Um,
ask you. I'm sorry to
yeah,
cut. I was
no,
listening
go
to a
ahead.
podcast with Joe Rogan, and he says that he had the craziest trips on taking large amounts of like edibles. Yeah.
Yeah,
Have you
yeah.
ever had anything? And if that's personal, that's okay not to share as
Yeah,
well.
no. It's very true, and I know of people that have done that. And the thing to do with that now, of course, with my product with CBD, that's not a problem at all because you don't get high with my product. But when you're doing cannabis, if you get too high, the best thing to do, it'll eventually wear off, and it doesn't last a long time. So one of the things you can do if you get too high is take some CBD because that helps mitigate the high quite a bit. Keep well hydrated, stay in a nice, calm, cool area and just kind of wait it out if you can when you're getting too high. But the better part of that is not to eat so many edibles to begin with. If you're in a party situation, edibles may not be the most social thing to do because you eat it and then 2 hours later you start getting high and that's not a party scene, right? So a lot of people vape or smoke, and you got to be careful with that, but you know when you're getting too much and you can back off of it and it subsides really quickly.
So those listeners that are having a bad trip, no problem. A couple nurses just explained how to freaking mellow out a little bit. So, but back to like the science part of things, I'm actually
Yeah,
curious on. Have you found any studies that REM sleep was improved or sleep quality by taking a CBD product before going to bed?
absolutely. And actually, my Instagram post and my Facebook page this week just posted a little article about sleep and REM sleep, because this is National Sleep Awareness Week, or it was last week, right?
Okay.
So there's some information on there. REM sleep, you go through about 6 or 7 cycles of sleep in an 8-hour sleep night. And the first REM is maybe about 15 minutes to a half hour. And then the second REM gets a little bit longer. And the third REM cycle gets a little bit longer. And being able to stay asleep to take advantage of those REM cycles is really important. And people that take CBD, and I have a rest CBD that has just a little bump of melatonin in it, help you keep asleep so that you can take advantage of those REM cycles, because it's the longer REM cycles that really build on, making you feel rested when you wake up in the morning.
That's good. It's good stuff. I have a question regarding, because for or I know that you can't really overdose on a marijuana, or like there's some research shows that you can't overdose on LSD or psilocybin, but you can't overdose on CBD as well, right? It's not possible to do
Yeah,
that.
no, it's absolutely not possible. The only thing that happens when you take too much CBD is you end up wasting it.
Okay.
And so that's why everybody says start low and titrate up, because you don't want to take more than you need to take. And cannabis has kind of a biphasic attribute too. So cannabis, sometimes if you take a little bit, to relax and everything, if you take too much, you may get the opposite effect of that. So if you're taking it to relax, taking more of it once you get to that relaxation is not going to help you relax more. It may kind of backfire on you and make you more anxious. So that's why everybody says, take as much as you need and then back off of it. So, but no, you can't really overdose on it. There's no overdose.
Is there like a protocol for like microdosing? Is that a thing with CBD?
Microdosing is a thing with all cannabis now, that more and more people, there's more research coming out on microdosing. When you take CBD or you take some THC, there's a therapeutic window. And as you start easing into it, usually in about 3 days or so, that therapeutic window begins to widen a little bit more. So if you start and you've never taken it, or you haven't taken it in years, you want to start really low and wait for about 3 days if you're taking it medically, to see where that therapeutic window opens to. And then, slowly titrate up from there. And then, you'll reach your therapeutic benefit. But as you go along, a couple weeks, a couple months later, you may need to take a little bit more to achieve that same effect. So you start to feel like you're not getting that same therapeutic level. Then you want to just back off of it for a couple days and then start again. And then that way you're not taking more and more and more and spending much more money. You can kind of reset yourself.
Interesting. I like that. Are you offering a discount code maybe for anybody that's like a listener that's tuning in right now as we kind of slowly start wrapping things down? Is that a possibility?
Yes, of course it's a possibility. Actually, right now through Sunday, I have a spring discount of 25% off of everything. But if you happen to be listening now and you want to get that code, I also offer year-round. Nurses get automatically 20% off of their whole order for all of 2020 in honor of Year of the Nurse. So if you're a nurse, there's a special nursing code. It's NUR 2020, and you automatically get 20% off your entire order. But if you order now to Sunday, you'll get 25% off just for the spring situation. And for celebrating this Cup of Nurses podcast, let's do an extra 5% on top of that nurse discount.
All right. It sounds
So
awesome.
if you go on the website, you'll see that.
Yeah. And then for the products, you offer like I'm not sure you mentioned it before, but you offer like edibles and you can smoke the CBD. What kind of products do you offer on your website?
So I have gummies in little pocket pouches so that you can throw in your purse or your pocket, in jars of gummies. I've got 3 different kinds of gel caps, a regular 10 milligram, which is good for beginners. and 25 milligram that has curcumin in it for inflammation and arthritis, and a 25 milligram that has a little bit of melatonin for rest and sleep. I also have a tincture that's super concentrated, so only a couple drops will go a long way. And you can put that tincture drops in your coffee, in your tea, in your yogurt, any kind of food item. Or I have the Perfect Balance Singles, which is a great sublingual. That's what I take every day. And that comes in like this box like this. And it's all, what happens is it's a single dose of 20 milligrams of CBD. So it's dose accurate and it's easy to take, and you don't get it contaminated like you would if you had a multi-dose dropper bottle. In the hospitals, they've all gotten away from multi-dose bottles. And why is that? Contamination and dose accuracy, right? So everything comes up single dose these days. And that's why I'm the only company that has these single dose tinctures. Maybe because I'm a nurse, and when I was testing out everybody else's product, the fact that I was trying not to touch my mouth in the hundreds of bacteria and the amylase enzyme that's in our mouth that breaks down, putting that dropper back into a bottle full of CBD and funking it up just was really disgusting to me. So I have these singles for people who like to take it orally.
I like that. And for like the people that are a couple of nurse listeners and they're probably wondering, do you want to offer like a discount code with like cup of nurses or content or something like that? Would it be something specific just so they know if they're listening right now?
Let's do that. Let's do cup of nurses, and they get 25% off of everything. And
Cool.
I'll extend that for a full week. So that'll go beyond the original discount that's going on now, just for your listeners.
So we'd have to talk when the episode would air and things like that. So we kind of try to
Absolutely.
record sometimes in advance, especially working as nurses. Back to back 3 shifts. Of course, sometimes managers have to, or the people that make our schedules, like nothing ever becomes completely aligned, and we sometimes only have like a day or two together to like nail things and get some work done for the podcast. So
Yeah.
it's been a fun time.
Oh yeah, and I'm sure with the coronavirus out there and devastating everybody's worlds, you never know what your schedule is going to look like these days.
But
Hopefully
yeah,
you guys are staying healthy.
we definitely are, and
Good.
it's kind of scary thinking about things where the CDC is changing things to droplet contact, and this mirror of time. There's different guidelines. I think as we're recording now, the CEO or whoever of World Health Organization is actually making an announcement. So just imagine being in his position, like talking to the whole entire world of what the heck is going on right now. It's we're living interesting times.
Well, I was just telling Petey before the show that I just got an email from the Women-Owned Business Association. It's a federal group that reached out and said the White House is looking for supplies, and they're looking for gloves and masks and all of this, which I thought was kind of interesting that the White House is reaching out to federal contractors looking for extra supplies to just keep up with the demand.
Yeah, it
Wow.
shows you crazy how like I'm not sure there's a shortage going on currently, but it just shows that there's potentially a shortage for like these masks, these gloves, something that we took for granted as nurses. Like how many times has like a you taken the gloves out of the box and like 5 of them fell on the ground, you just threw them out, or how many times you
Right.
take out the mask out of the box and 3 of them fell out, you just kind of waved it off, no big deal. Like it's crazy that we take these things for granted, but they're on short supply. Like look at Italy with the ventilator issues. Like I've
Yeah.
heard that sometimes they're saying that if you're above a certain age, we're not going to treat you. We're just going to make you hospice. I think it's if you're above 70 or 80 years old, they're so short on events that if you're above that age, in an age gap, then you're automatically on hospice and I'm not going to do anything for you treatment wise.
I know. It's heartbreaking.
That is crazy. All right, guys. Thank you for listening. Jerry, it was a pleasure having you on. We definitely should talk again. And for those that are curious, the website will be on the show notes. And if you go to episode info on Apple or whatever, and it's tuliptreecbd.com, guys.
Thank you guys. I appreciate it. Love talking to you.
Yep. Thank you, Jerry. Have a great day.
Thanks. Bye.
Bye, guys. Chat soon.